So one of the newer things that we're doing these days is something called Tenex Health. And what this is, it's for very common problems like tendonitis, which is really a misnomer, a misnamed diagnosis where it's really a tendinosis, where it's a degeneration of a tendon. It's not truly an inflamed tendon if you actually look at these things under a microscope. And so what we're doing nowadays is, standard treatment options can apply with counterforce strapping for the elbow, bracing, occasionally doing steroid injections, but that's also controversial these days. One of the newer techniques that we're using is something called the Tenex Health Probe. And what that entails is it's basically a very small tipped needle that has an ultrasonic energy source at the tip of it. And it basically emulsifies or destroys the tissue of the diseased tendon, which you identify under an ultrasound, through a very, very small incision of about 2 to 3 millimeters. And it basically irrigates and washes that tissue out of the tendon, out of the elbow. And so it actually tries to remove that tissue surgically through a very, very small incision. This is a newer technology. It's still being studied extensively, but we've had very good early success with it at this time, so much so that I've even sent my mom to have it done for her hip for some tendon problems she was having down there, and she's also done very well with that. So it's exciting, it's interesting. We're looking to get some research together for it as well, and hope to be using this much more in the future.